In recent years, Envita Medical Center has become one of the frontrunners for the advanced delivery of genetic and immunotherapy-based cancer treatments. I had the opportunity to sit down and meet the founder and CEO, Dr. Dino Prado, to discuss their new therapies and why so many patients have chosen Envita and their Unipathic approach. Dr. Prado, thank you very much for taking the time out of your busy day to meet with me. To start with, could you give me some background on Envita and their approach to cancer?
Envita's background started a number of years ago where we started to develop therapies for cancer patients. Patients were coming to us under the understanding of integrative medicine because they weren't responding to conventional care. They were being sent to hospice or on a clinical drug trial, and they wanted to know, is there anything natural? Is there anything else I can do? And that's where it started. Now, over 15 years, we've done a ton of refining to really narrow that in. And we're getting better every day at the best drug targets, the best plant phytotherapeutic targets, the best immunotherapy targets, literally to the point where we clinically feel like we're just outperforming everybody in the industry. And we're very happy and proud that our patients, when they come to us, are still responding to care. They have a better quality of life, better length of life, and a better chance at remission.
Genetics have been called the future of cancer treatment. For the last 5 years, you and your team at Envita have been providing patients with genetically based cancer treatments. How is what you do different from other cancer centers providing genetically based therapies? And do you believe genetically based chemotherapy is the future of cancer treatments?
That's kind of a catch-term phase, genetic cancer treatment. The genetic data they're taking it from biopsy. We don't even use a biopsy. We use a brand new technology that uses circulating tumor cells that are in your body from a normal IV draw. We take the freshest data from the freshest mutations, and then we base the treatment on that.
Envita's GTF chemotherapy, or genetically targeted fractionated chemotherapy, is a process in which circulating tumor cells are genetically tested to find what specific chemotherapies and supportive natural agents may work best on an individual patient's cancer. This information is then used alongside a specific therapy protocol to help achieve the most real-time, genetically matched cancer therapy available. Due to the GTF therapies process, low-dose and multi-targeted chemotherapies are able to be used, which can help reduce the conventional side effects of standard chemotherapy and help in improving the targeting of a patient's cancer.
We believe that as many as 5 or 10 years from now, with the work that we're involved in around the world and a lot of other cancer groups are, chemotherapy might become completely obsolete. And the reason is the immune system, which is an area called immunotherapy, is really the forerunner of changing the way we treat cancer.
I know Envita has been working with their international partnerships to create a new immunotherapy regimen called IMX Therapy. Could you explain what this process is and how it benefits cancer patients?
The problem in the past with immunotherapy, a lot of the oncologists have said, well, it doesn't work, it's not working as well, we'd like to see it, is because the cancer cells find a way to evade immunity. They just find a way to escape the immune system. They develop changes on their surfaces, they send out chemical markers, they block the immune system from working. We have been working on technology to basically look at your individual fingerprint of your cancer, then take your immune system, your own immune system, genetically engineer it to recognize those changes and go after the cancer without the ability of it being diverted.
Dr. Prado and his colleagues have been working on a unique process for genetically engineering certain cells of the body's immune system to fight cancer. Their focus has been on natural killer cells, or NK cells, for over a decade. These cells are able to find, target, and kill cancer naturally within a patient's body.
What we're doing that's super special is we're able to take this antigen information, receptor site information, engineer it in real time right on that surface of those natural killer cells so that their only job is to seek and destroy.
Dr. Prado explained that when a patient has cancer, the cancer cells find methods to evade the body's natural immune defense towards cancer. Envita's new IMX process, which is currently only offered in their international division and is not FDA approved for treatment within the United States, is taking NK cells and helping to increase their ability to target and kill cancer cells. Part of the IMX process involves finding markers on cancer cells and teaching the immune system to recognize and then target cancer.
You're seeing that, yeah, you're seeing it start to keep going, you watch it play, and it's just dissolving dissolving the entire cancer just until it's all gone, and it's all being done by your own immune system. So I mean, we really look at this. It's game over. It's basically like the immune system finally said, I didn't know where you were, but now I can find you. Once I got you, it's over.
Why has Envita looked to international partnerships for the advancement of their technology?
The reason we've partnered internationally, and we have one of our centers in Mexico and Hermosillo, is because that some countries just have better biologics laws than the US. We use the same quality standard, same GMP, same setup of study and so forth. But the purpose of working in other countries is that their laws are more favorable for that particular type of work. They still have regulations and rules, but they also have better laws in place for that technology to evolve quicker.
Envita has been called one of the most innovative cancer centers in the country for genetic-based and immunotherapy-based treatments for cancer. Why do you think this is?
We're not happy with the current answers. We've never been happy. Our situation is our patients come to us after everybody's failed them. So guess what? What people think is working isn't working. That's why cancer is a scary word. So we've constantly have a commitment to evolving that technology to save life. When you focus everything on patient outcomes, you're evolving. Because you're not happy. You're not happy that somebody's living a year longer. You're not happy that people are just having a little bit more energy than they had anywhere else. You're not happy because their tumor is just shrinking 30% more. You're only happy when you're helping them get into remission. And until you reach that goal, you don't stop.
What is the future of cancer treatment? Only time will tell. Envita and its colleagues are making progressive strides in cancer, with the hopes of a better, detailed diagnosis and more detailed, personalized, and viable treatment options.